Hello, welcome to Chatting with Chitness. I'm Dr. Salil Chitness. I'm a pediatric emergency medicine physician, and we're going to be talking about pediatric medical education. We got a very exciting video, so let's get chatting. Welcome back to Chatting with Chitness. Today we're going to talk about intussusception. Say that 5 times fast. So what is intussusception? It is actually an obstruction. We'll put a better picture of how it looks, but basically your intestines are tubes and the tubes get stuck inside of each other and it causes an obstruction. Actually, the crazy thing is we all have intussusception all the time. Just little kids, it gets stuck. As we get bigger and older, it'll get stuck, but unstuck on its own. But little kids, they get stuck and they need more help. So what are we looking for, or when are we concerned about intussusception? So usually the most common ages are 3 months to 3 years old. And they'll have severe pain that comes and goes. And that's the key with intussusception is the pain comes and goes. Over time, what ends up happening is the pain gets so bad, our body releases endorphins, and they release so much that the kids actually become very lethargic and sleepy. So if your kid is having like this severe pain that comes and goes, and then all of a sudden is way sleepy and lethargic, then you should be concerned about intussusception. One of the late findings is the stool will actually be currant jelly colored, which is like this deep red. And that's actually a late finding, and that's not a good finding. That means that the intestines are actually dying and they're bleeding. So if that happens and you see that in your kid, you need to go to the emergency department as soon as you can. How do we find out and diagnose intussusception? Well, the great thing is we just need to use an ultrasound, which is one of the best imaging tools because there's no radiation. They just ultrasound your kid's belly looking for intussusception. Now, if your kid ends up having intussusception, how is it fixed? So the first choice is to do an air enema, which is basically they just pump air up your child's butt and the air will push the intestine out of itself and then they get better. If that doesn't work, it's very rare that it fails, then they will need surgery by a pediatric surgeon. But usually the air enema works. I think I can only remember one time where they needed surgery, and I've seen this quite a bit. So that's it for intussusception. Please leave any comments so we can chat about it next time on Chatting with Chitness.